Hello everyone. Today we will be going over the asthma clinical pathway as part of the education and training phase in the UCCs. The creation of these clinical pathways have been made possible by collaboration of the Clinical Effectiveness Program and the Evidence-Based Medicine Council. This has been a multidisciplinary effort of physicians, PAs, NPs, nurses, and staff from the UCC, ED, hospital medicine, ICU, pulmonology, and IT department. There are three phases of the asthma clinical pathway, which includes the ED phase, UCC phase, and the inpatient phase. Today, we will focus on the overview of the UCC phase. In the next few weeks, we will go over order sets, power plan use, documentation using the ED UCC respiratory template, and discharging patients with an asthma action plan. Lastly, we will set up conference calls for final review of the asthma pathway and Q&A sessions in preparation for our go-live date in December. Here are some learning objectives. We will be able to locate the UCC asthma pathway under PEDS Medical Resources folder. We'll have an overview of the pathway. We'll review the respiratory score, and we'll recognize key components with emphasis on quality metrics. Here is the UCC phase of the asthma pathway. I'd just like to remind everyone that this can be found under the PEDS Medical Resources folder. Now, chest x-rays and antibiotics are not routinely recommended. When a patient is triaged, they should have a documented respiratory score. If they don't, please remind the nurse. With a respiratory score, we will then stratify our patients into the mild category, the moderate, and the severe category of the pathway. Under the discharge plan, we have to remember to complete 2 doses of dexamethasone or 5 days of prednisone or prednisolone. And for the quality metrics, the Clinical Effectiveness Program will be tracking the frequency of patients treated according to the pathway. That's a power plan use. And the frequency of patients undergoing chest x-ray, the UCC length of stay in hours, and the ED UCC return visit at 72 hours and 7 days for the same costs. Now just to go over the respiratory score. Again, this can be found in the PEDS Medical Resources folder. The respiratory score has 4 components. It has the respiratory rate, retractions, dyspnea, and the last component is the auscultation. You will give a score of 0, 1, 2, or 3 based on the 4 components, add them up, and then you should get a score between 1 through 12. Again, these are the highlights. Chest x-ray and antibiotics are not routinely recommended. MDI is a preferred method for inhaled medications. We have to complete 2 doses of dexamethasone or 5 days of prednisone or prednisolone. And we have to initiate the asthma action plan as soon as possible. Thank you everyone for listening and watching this presentation. In the next few weeks, we'll go over the order sets and power plan use. Thank you again.